14th position that's resigning. On Friday we were told there were 13. Who was that 14th?
Dr. Joan Quinn is the 14th physician, I believe.
Psychiatrist and carbineer, is that correct?
Yes. Yeah.
Is there no equivalent two-tiered system in other provinces for salaried specialists? Is this absolutely unique to Newfoundland? What is presently happening between these two groups of specialists?
I have no knowledge of any of the other provinces having different tiers. We're looking at the base salary, for specialists. And like I said, up to 2008, the salary scale was the same. In 2008, there was a 35% increase given to that oncology pathology group of 60 physicians, and the government has not decided that it is worthwhile to try to give the other 150 salaried specialists that same package, and that's the crux of what we're dealing with. They've offered a much lesser amount, so you will still have a two-tiered system after the 4 years of this deal have been finished.
You do have tiers within it, and people are paid market differentials and stipends and recruitment bonuses and these sorts of things, and those are, you can't have that variance across specialists, but the base floor salary is what you're talking about. There's a huge gap that exists there.
Yeah, it's the base salary is what we're talking about, and in fact, we have the numbers. The current base for the salaried specialists who are not the non-oncologists and pathologists is $180,000. And the current base for the oncologists and pathologists right now is $255,000. So the government of Newfoundland offer would raise the salaried specialists from a base of $180,000 a year to a base of $239,000. And the oncologists and pathologists at the end of the 4-year deal would be raised to $276,000. So we're looking at a variance of about 15–16%, or about $37,000 per year on the base salary is what we're talking about for the 150 salaried specialists who are outside of that deal from 2008.
But the oncologists and pathologists are still getting their stipends and bonuses that the other specialists.
Yes, this is based on the base salary. Any bonuses or stuff outside that we're talking about the base salary.
37,000 times 150 people is $5.5 million.
It's very good.
That's so. This is a $5.5 million problem, because I'm sure the government's going to come back and say it's much bigger. Because I heard over the weekend it was an $18.5 million problem. Is that to solve the stipends and everything, or?
I think this is that's on the base salary is what our salaried colleagues, the 150 salaried specialists, would like to get that base salary. So that's the raw amounts. The government would say there's also money for locums and for other bonuses and other things like that, so that the number you quoted is what we thought it was. The government has come back and said it's going to be a little more than that, but again, we're talking a fairly small amount of money when you look at the $81 million the government has offered.
There was some term used too about shadow billing, something newly brought in from specialists where they could bill over and above their base.
That's a very complex issue. I'm not sure I want to get into that right today, because we're still trying to get some clarification about what the government had entailed with shadow billing. Shadow billing is a fairly complex issue, and we're not exactly sure completely what the government have offered in that. Shadow billing, for those who don't know, is that people who are on salary still have to submit MCP claims, and they get paid a percentage of what that claim would be for a fee-for-service physician, and it's a way of helping to know exactly what they are doing. So it's a very complex issue, and again, we're not really sure what the government has offered. It's going to take a while to implement. Most provinces are starting to implement some type of shadow billing program for salaried specialists. It's a long way from coming here, we think.
That tends to look at this issue strictly on a workload basis as opposed to a skilled basis. Like, there is a market value on some of these skills that you could be highly sought after, not necessarily shadow bill a lot to justify a workload increase, but there's like one Kennedy in the country type thing.
You can't base it on just on workload, or just of course MCP and shadow billing and fee-for-service is based on the volume. It's on every patient you see, you bill. The specialists are on salary for a lot of different reasons, sometimes because they're of the complexity of their work that they do. They spend a long time with each patient, and it's difficult to generate enough income if they went fee-for-service.
So the $5.5 million that my math came up with on the salary gap, That's what you thought it was. What did the government come back and say the gap was? Have you got that number?
I don't have the exact number. It's around 7 million. I vaguely remember from discussions, 7 or 8 million, but in that ballpark.
$1 million in the difference.
Yeah, we think so, yeah.
Just
No. But this, you have to remember, this solves this issue. There are other issues within our negotiations that would probably cost some money. And again, we're not going to get into negotiating in public about some of the other issues. That's for the members to decide once they see the full package of what the government has been offered.
But they're probably throwing in that shadow billing figure too, or are they in the figures that David's talking about?
They possibly. We have to get clarification on exactly what they mean by the shadow billing and what the money is involved in.
Some of the things for shadow billing, you wouldn't even have fee codes for some of the services because they're
Exactly.
simply offered through salary, so it could take a year or two to implement that.
It's
so
going to take a
they
long
wouldn't necessarily get the
time.
money,
It's going to be
right?
very difficult to get the fee codes. There may be some existing, there may not be fee codes for some of the stuff that these specialists do.
What is your advice presently to a doctor or a new doctor who might be considering practicing here in Newfoundland?
I think it's a great place to live. We love Newfoundland. All the physicians in Newfoundland are here because they want to be here. And it's indeed sad that some of our colleagues are looking elsewhere now in order to practice and move their families. It's still a great place to live. I think it's going to be very difficult to recruit new doctors here right at the present time with the current climate and the current environment. And you wonder about someone who decides to come here at this time. So I think it's going to be very difficult. I think it's going to be a very difficult recruitment process. And like I said, I wish them well. Our patients would hope we can find people that are willing to come, but I have grave doubts about that. Any other questions? Thank you very much. Thank you very much for coming.